Matthew Hamburger, and let's talk about the dreaded pain. So, pain is quite complex. It's overall misunderstood, and for this segment, we're going to talk about the difference between acute and chronic pain. Let me just preface that there's no way I'm going to be covering everything on acute and chronic pain, but I think this is a great way to sum it up. So, pain is a signal in your nervous system that something may be wrong. Oftentimes it's your body telling you to stop doing something, stop doing an activity. Maybe you're about to touch some fire and you'll get that pain. It's an unpleasant feeling. I think we all can agree with that, such as a prick, a tingle, a sting, a burn, or an ache. I personally see ache as something else, but that's another conversation, another video. Pain may be sharp or dull. I think we all can agree on that. And it may come and go, or it may be constant. You may feel pain in one area of your body, like your back, your toe, your ear, your abdomen, or you may feel it throughout your whole body. You might even feel emotional pain. I believe that is pain. And yeah, physical pain is a sign that tissues are being damaged or those tissues are in danger. Think of that time you reacted and said, ouch, okay, before anything actually happened. Okay, your body is amazing. Us humans are miraculous. We react so quickly at times. So one thing that through my anatomy journey of learning the body, so many people think of tissues and we think of like what we blow our nose with, but no. Okay, let me give you some examples of tissues. There's 4 main kind of body tissues. There's what's called epithelial tissues, which is they blur together a little bit because they work together to form different elements and systems in our body. So that's skin, different glands, mucous membranes. Mucous membranes are in the nose and other parts of your body that you can research that I don't want to talk about. Connective tissue. That includes fascia, bone, fat. Also mucous membrane, which is where things get complicated. Tendons. Then muscle tissues. So that includes obviously muscles. Then we have veins, our heart. We have some organs as well. And again, I'm not going to go too deep into it, just running by them. And then nervous tissues like brain, nerves, neurons. And again, this goes way more deep down. So the reason why I wanted to look into this and present this to everybody is through my journey with yoga. I have seen so many people and so many of my holistocrats and our clients and even people that aren't my clients overcome chronic pain. And I really wanted to understand it. I have a brain where I analyze the physical stuff first and I just get the physicality. So that's why Posture Police exists. Because I wanted to solve our physical muscular imbalance and our movement patterns. But yoga does something different. Yoga does something even greater than Posture Police can do. So, and yeah, I genuinely believe that. There's a reason why this 5,000-year-old or so wisdom still is relevant today. So let's talk about acute pain. And we're going to contrast it with chronic pain. So you get the difference, and then we're going to talk about the similarities. So acute pain is known to come on suddenly. If you stub your toe, that is acute pain. If you burn your hand, that is acute pain. If you throw a baseball too hard and you pull a muscle and you have pain, that is acute pain. That coming on suddenly is oftentimes an injury or damage of cells or a protecting to prevent damage of cells and tissue in the body. That causes an inflammatory response. Generally, acute pain has a known cause. And because it has a known cause, we can oftentimes relieve the pain quickly if the damage is not too bad or the damage is not continuing. If we're getting continuous damage, that pain is not going to stop. So just to piggyback a little bit back and forth, chronic pain is oftentimes categorized as chronic pain when it lasts 3 months or more. And it often causes, I'm sorry, I take that back. It's oftentimes caused by the inflammatory response. So inflammation will be the cause of the chronic pain. And it's more complicated of a cause. It's a lot more multidimensional. And I'll go a little bit into this a little further. So back to acute pain. So I'm going to go back and forth a little bit. Acute pain can usually be diagnosed and treated a little bit more easily and oftentimes a little bit more straightforward. It's like, hey, just relieve that inflammation, rest, let it heal, and move. And it's like, I'm just talking about something that, from my experience of my own tendinitis that I've healed and helping people conquer what appears to be muscular imbalances that cause pain. Yes, that's one of the ways I treat multiple things. So this kind of pain is a sign, acute pain is a sign that we're doing damage to our tissues. And it's almost like it stems mostly from the tissue damage, and then it causes some thought and emotional programming, pain, stress. So it's like thoughts and emotions are secondary to the tissue damage. Whereas with chronic pain, it's a more complicated cause, because emotions oftentimes, especially with new research, cause, and it's more involved with emotions, whereas it's secondarily involved with the thoughts and then the tissue damage, inflammation, and such. Back to acute pain. So inflammation comes to protect the damage, and oftentimes, and much of the time, inflammation is the first step of the healing process. So this pressure itself, there's a part of the nervous system called the sympathetic nervous system, and having acute pain is actually a sign that our sympathetic nervous system is functioning properly. So sympathetic nervous system is the part of the body, is a part of the nervous system, part of the autonomic nervous system that just happens on its own, that prepares us for fight or flight, that prepares us to protect ourselves. It's kind of like our survival mechanism. So whereas with chronic pain, it's way more intricate. So we're going to go into some more detail with chronic pain. So chronic pain requires an integrative solution to solve. Oftentimes, depression and anxiety come and follow chronic pain. Chronic pain can be difficult to diagnose because there is a physical problem, but there's an emotional element to it as well. And there's oftentimes, because it's thought and emotion, there's a mindset element to it. So like one of the things that I remember hearing from all the chiropractors that I've worked for is that some herniated discs that are exactly the same severity result in pain, whereas other herniated discs with the exact same severity do not cause pain. And then another example is fibromyalgia. It's very difficult to diagnose. Oftentimes people think it's an autoimmune disease, and it's always hugely inflammatory. So one of the other things that comes with chronic pain is something that's called a pain disorder. And pain disorder is chronic pain experienced by a patient in one or more area that is thought to be caused by psychological stress. So when we're stressed out, I don't know if you've ever heard me talk about the stress-pain cycle, but this is where stress can keep ourselves in the chronic pain state. The pain is often so severe that it disables the patient from proper function of the body. So everyone I know, we know somebody who is in so much pain, so deep pain, that they can't function properly. And oftentimes there is a psychological element that they're feeding that pain. To go off on a baby tangent, I came to learn more recently that I've been doing a similar thing with anxiety, where I use it to kind of like shake me up to get moving. And it fuels me. It's almost like something that I feel comfortable in. It's something I identify as. I identify with this anxiety, and other people do. Like the pain disorders, we identify within the pain. So whatever we identify, we want to be. As much as it's a little sick, it's not nice, but it happens. Chronic pain can cause and is caused by the sympathetic nervous system hyperarousal. So that's when we're almost panicked in the fight or flight. So it's like we're hypersensitive, we're hyperreactive, we're overreactive. And chronic pain in its worst can lead to chronic inflammation, and chronic inflammation can cause, and systemic inflammation can cause a cascade of other health problems. So yes, when push comes to shove, pain sucks. Whether it's acute pain from an injury, and then we need to heal from that injury, and we have to come to terms that we might be limited while we're healing, whereas chronic pain is a lot more complicated. But this is also why yoga is so powerful. So regarding both of these, an inflammatory response is involved. If you're dealing with also a circulatory issue is involved. Blood flow, the additional pressure, inflammation and circulation kind of go hand in hand, and there's always a circulatory issue with pain, and blood brings the oxygen and the resources to heal the body. And when we have too much inflammation that is chronic, or when there's not actually damage, like it has been known that when you have chronic pain, sometimes you have the pain, but the injury is actually healed. So the blood flow could be there and causing pressure, but there's nothing to heal. with both, there is tissue damage. So there's always that inflammation in chronic pain can cause tissue damage. In both, there are movement pattern problems, where if it is a muscular or tendinitis or a joint problem, frozen shoulder, which is more chronic, but there is a movement pattern or a muscular imbalance problem that can occur in both. Thoughts and feelings of fear or stress can lower our pain tolerance. It won't necessarily make the injury worse or even make the problem worse, but I'm sure when you're connecting the dots, if our thoughts and if we're fearing, if we're in a lot of fear state or we're under stress, then what that can do is that can make us even more hyperreactive and hyper arousal with the parasympathetic nervous system. So you can see how that can make chronic pain worse. Whereas if you have acute pain and you're panicked and you're scared, that will literally lower the pain tolerance. So you can't actually deal with as much pain, and it's even that much more miserable. And then pain, both of them cause stress in the body. So after creating Posture Police, which is designed to be a hybrid of and the bridge between yoga and physical therapy, it's like the wisdom of yoga and the science of physical therapy, really designed to solve our muscular problems. Yoga is actually even more exceptional for chronic pain. It's brilliant. The wisdom within yoga addresses the physical and emotional body in such a way that it can heal us through the breath. So while practicing yoga, breathing is incredibly important. Prana. So while breathing and while doing a yoga pose, it can create the physical release and release the stress, locking the person in pain. Yoga also does a phenomenal job of getting you to listen and really shut down the thoughts and the external stuff so you can get in touch with your body, even the emotional part of the body. The present moment awareness that is created by doing yoga settles our thoughts and our feelings while enhancing our circulation through the movement. It's amazing. Like I'm still like kind of mystified by how powerful yoga can be. So settling the physical and mental causes of the pain and inflammation through constant practice. Like you really want to settle. So if you have one yoga practice and you make a baby step forward, okay, then we get back to our old patterns a little bit. So we want constant practice. We want consistency. The word here is consistency. Nothing is more important than having consistency to conquer, okay, that chronic pain. Baby step after baby step after baby step. There's many limiting beliefs. There's many emotional patterns that are associated with chronic pain, and we want to chip away at it. If you dive into it, you might cause some more pain, and that might turn that chronic pain into acute pain, which is not uncommon. If you overdo it, you can easily turn and trigger acute pain. And don't forget rest. Rest is important. If you're doing yoga all the time, or if you're in pain, our bodies need rest. We need to heal. So, especially with acute pain, like let's use a common bit of pain, like tendinitis. Okay, even though I don't diagnose tendinitis, it's apparent when someone comes to me with tendinitis what to do. So we want to rest. You want to reduce the inflammation. Oftentimes ice is really good for that. And then you want the proper movement. You want the proper blood flow. And then you want more rest. It's simply true with chronic pain as well. You want to rest and let the body heal. You want to let the physical body, the emotional body find that balance and equilibrium. And we want to find that holistic balance between mind and body. We're not talking about spirit at all in this video. That's a whole different story. If you're doing non-stop, like yoga, exercise, anything to try to heal, just anything repetitively, okay, the body doesn't get a chance to actually rest. And rest is so incredibly important for chronic pain. So, I'm going to leave this video with just saying one thing. I still am mesmerized by what yoga can do for the body. Whether you take a yoga class online, I urge you to look for a beginner yoga class. I do not recommend an all levels yoga class if you have chronic pain. You will be keeping up with people that don't have pain, or you can find a program that is designed for chronic pain. And here at Holisticrats, we work with many people with chronic pain. We help them conquer it from the physical aspect, the emotional aspect, and the mental aspect. And we really want to get you out of pain. So, on that note, I wish you all a balanced day, and take care.